Hi, I'm Chris Tackett with Intel's Health and Life Sciences Group, and I'm thrilled today to be with Dr. Brian Keeffe from Marin General Hospital, cardiologist, and Stanley Crane, Chief Innovation Officer with Allscripts. What are you guys seeing in the environment with electronic health records these days? What are some of the pioneering things that you're seeing that electronic health records are bringing to not only your hospital and health system, but possibly even your patients?
I'm seeing just improvements across the board. Relative to when I started 10 years ago, it was kind of a view only. You could see some information, but we still dictated everything. And over time, we've been able to, do more charting in the EHR. Now we're getting more mobile. All of our problems and history and medications and everything is now in the chart. And almost in my community, no one is doing it the old school way of using the chart as view only and dictating. So more is available, in the chart. There's almost too much information now. We have to start cleaning it up because everyone's using it in a lot of different ways. But the ability to, within a community, to know everything about your patient is there now, and that's huge.
Great.
Yeah, you talked about mobility. I mean, that to me is one of the key words. Instead of, in the olden days, everybody had to go to a workstation. So,
Right.
And sometimes you'd be someplace and you'd see a line of people waiting to use the computer. And then it became the laptop, but it was still a laptop that was frequently bolted to the wall. So
Right.
it might as well have been a desktop. And today, with like the Windows 8 machinery, what we're seeing there is people are carrying it around with them. It was actually a nurse at Marin Medical who showed me the little trick with a Surface to let it perch on your arm like a parrot, and you can carry it around that way. And it's like,
Great.
but that mobility doesn't mean cell phone. It means moving the information around to wherever the person happens to be and taking advantage of the person in their geography, as opposed to, the computer is out on the nurse's station and there's 3 of them, one for docs, one for nurses, and we don't have to do that anymore. We put the information wherever the doc is in front of the patient so that they can get the data in and out. And one of the things that Brian talked about was this idea of, now that we're capturing more data, we're starting to have a little bit of the opposite problem. How do I filter the data to what do you want to see?
What is real,
not
yeah.
here's all the voluminous activity about this particular patient.
That model of the workstation, that is still the standard.
Yeah.
I mean, most doctors are slow in general to change because they feel like they don't have time to change because they're too busy. So the current model, at least in 2 hospitals I work at and in my outpatient facility, is workstations, one place, go to nursing station on the 2nd floor, log into a computer, log into the applications you have to get to, see one patient, move to another floor,
Right.
go to a bolted down computer, log in again. And when Stanley showed me what he was creating with Allscripts and the wand and using the Surface, a light bulb went off in my head. Wow, I can log into the 4 or 5 different applications I have to log into at one hospital to get on my imaging systems, my EHR, everything I need to see the patient. And then when I go up to the 3rd floor, I'm still logged in.
Great.
I don't have to do it again. I can walk into the patient's room and click through with a pen and say, here's all the information I need, and I'm not, it's so much more efficient, and it's all possible now. I think doctors are slow to change, so I'm trying to help doctors in my community, see that, that efficiency means a lot. Having all the data at your fingertips means a lot.
What are you seeing in the improvements in workflow? For example, nurses having a patient's record at their touch instantaneously, or a doctor being able to enter a patient's room and get briefed quickly with that electronic health record. How are you seeing mobility play a role with instantaneous information or information at point of care for you?
When I'm seeing patients in the outpatient clinic, I have my medical assistant using a Windows device, and so she goes out, calls for the patient. She has her parrot on her arm and walks up, and there's a scale first. Many times the patient may say, "What did I weigh last time?" before she would say, I don't know. Now she says, oh, last time you weighed 170 pounds.
Great.
She takes them into the room. She has the device. She takes a picture of them. That information is now in their chart. She just clicks in their vital signs.
Right.
She doesn't walk over to a computer facing the other direction, talking to them that way.
Right.
She is talking to them like this.
Excellent.
It makes a big difference. Same thing for me. I can walk into the room. I can sit down. I can look the patient in the eye. I can have all the information I need in my lap. I can easily click with my finger, anything I need. So there's an efficiency part, but there's also, it's a more personal touch. Because a lot of complaints when you read about patients and doctors and going electronic with health records is that, the doctors are sitting there not facing them,
Right.
typing.
That engagement between
That
the patient.
engagement, yeah. And I'm very IT savvy in my world. My one rule that I don't do with patients, I don't type with them.
Yeah.
So I'll click, but I maintain eye contact. I mean, I'll do this and I'll look briefly to the side, but I'm not going to stand there not facing them and click. So all these mobile devices allow for that, more personalized
Very good.
care.
That's the flexibility. You can pull the keyboard off. You can have a keyboard when you need one. You don't have to have one when all you're doing is referring to the information. So it's really, meaningful use has put an additional data entry burden on the docs and the staff. They have to enter more data in a discrete fashion than they ever had to do before.
Right.
So how do I get you to do more in the same or less time? We have to come up with solutions. And our little lollipop thing for how do you enter vitals, where you just go around the circle to enter vitals, I think that hopefully that sped people up. And it wasn't using a keyboard, it's using your finger. So how can we do things like that? And then the way we can we're constantly challenging ourselves to come up with better, more efficient ways to present the information to the physician, but also to collect the information from the healthcare professional so that we get the data from the nurse, we get the data from Dr. Keeffe. That stuff all flows in and out so that he can spend more time, spend time with that eye contact. But we have to get the information there. So one of the keys here is you got to have quick access to all the information. What did you weigh last time? What was your last hemoglobin A1C? What was your last cholesterol? What was your last? We have to answer those questions so that Dr. Keeffe can make a decision today about this particular patient.
Excellent. Stepping back a little bit on the history, electronic health records, right? We've come a long way. But looking into maybe the near future or 3 to 5 years from now, where do you see the technology going? Or what do you see as wishes for the technology to be in maybe 3 to 5 years? For example, interoperability is a key issue today. Where do you see interoperability possibly playing a role, or other areas, maybe wearable devices or integration from telemetry coming in from the patient when they're not in the hospital that you want to monitor? Where do you see that moving?
I don't know. I think it's limitless what's possible with today's technology. The things that I see happening are with patient portals expanding, is more information getting into the chart via the patient. So it should exist. It doesn't yet. That for me, when I see a patient as a new consultation, that they've entered in all their medical problems already, at least in layperson's terms.
Right.
And then maybe my medical assistant can adjust that into doctor's terms. So more kind of patient engagement in the chart. And then interoperability would be wonderful. I mean, if I had a patient who moved from Chicago to California and came to see me, and they had been in a completely different health record, instead of getting a 100-page faxed document on all their things that I would have to manually enter in or scan, if that just dropped into my chart, whatever I was using, that would be a dream come true. I mean, I think that will happen someday. I don't know if it's 3 to 5 years. I think it'll happen. And I think all the wearable technology is very interesting. I think there will be a lot of questions that need to be answered for that. How does this data get viewed safely? You know, there is something as too much information.
Right.
You know, when something happens on patient data at 2 in the morning, who's looking, who's watching, and who's making sure there isn't an intervention that's needed?
Yes. Yeah.
How is that compensated?
Right.
And then, you know, all of this wearable technology and data that's possible, how does it flow into the chart seamlessly?
So workflow's a big key. in this.
Workflows is key. Getting all the different software systems to talk is key. I mean, I think it would be great if I could say, you know, check your blood pressure daily, and I would just get it. It would just be there.
Right.
Instead of, you know, patients write it down and they bring in a little piece of paper.
Right.
That's what happens currently.
And that patient engagement, right? That
Yeah.
gets you closer to the
Yeah.
patient. Patient feels more secure that somebody's caring for them
Absolutely.
real time.
So the interoperability is I think one of the real keys. You know, we've had some changes, I think, in the industry at large. You know, we started 7-8 years ago now with our open initiative to have an ability to give a programmer access to the information that's inside Allscripts. The rest of the industry is kind of catching up, which I think is awesome, because at the end of the day, when's the first day everybody's driving a Toyota or a Ford or a Mercedes or whatever it is? You know, in the automobile world, of course, there's going to have to be interoperability. Today, we have Toyota roads and Ford roads and Chevy roads. We need to bring these things together so that as patients, we all benefit.
Right.
The more information that we can put in this guy's problem-solving brain, the better the chances are that he's going to be able to look for trends, look for opportunities to help us. And where does that data come from? And I think the answer is going to be somewhere between.
Right.
I think we have the opportunity to create terabytes of data that we can inundate the docs with. But I also think, so if you know, a patient sees Dr. Keeffe, goes home maybe after a surgery, to monitor that patient for the next 30 days or so with some of these wearable devices so that we can interact with them electronically as opposed to come see Dr. Keeffe once a week, take up space in his waiting room, spend half an hour driving to the doctor's office for 7 minutes, hey, you're fine, come back in a week.
Right.
Why couldn't we have done this electronically and let the patient take care of themselves at home, as opposed to, I don't know how many docs really care how many steps you walk today. If, as you're a normal, healthy individual, there may be certain cases where you want to know that, but in other cases it may not. And it's going to be, I see, a mix or match. But again, it's interoperability. It's how do we capture the data without the doctor having to physically type anything. Now, whether that comes from wearable devices or coming from some foreign system. So you come to a trade show in Chicago, you step on a rusty nail, you go back to California. How does that doctor find out what happened to you after you stepped on the rusty nail? Did you get a tetanus shot? Did you need a tetanus shot?
Right.
And those are the kinds of things that, you know, to work on the $1 trillion problem, the $1 trillion waste problem, we have to stop things like the tetanus shot we didn't need.
Mm-hmm.
If you need one, absolutely, you should get one. But it shouldn't, I've called this the credit report of healthcare. You move to California. You want to buy a car.
Right.
They check your credit report. You didn't do anything to get a credit report. You didn't physically take your records from St. Louis or New York or Chicago. You didn't do anything. You just have one.
You
Right.
didn't fax it. You didn't call the office and have it faxed.
Right.
Yeah.
Yeah, you didn't do that. You didn't call Visa and say, hey, can I have a copy of all my transactions for the last 5 years so I can
Right.
give this guy
Right.
a bunch
Yeah.
of transactions? There's got to be a way that we can simulate that. There is no
Excellent.
single place where all of our credit information lives.
Right.
But wouldn't it be interesting if we posted it all someplace? So that, step on a rusty nail, I mean, I've always hated the question, when was your last tetanus shot?
You tell me.
Horrible.
That's what it should be, right?
I have no
'Cause
idea.
I don't know when mine was, but
I shouldn't have to know any more than I should have to know, you know, what did I pay for my last car?
Excellent.
Oh, by the
Yeah.
way, how often do you pay your Visa bill on time?
Right.
And I'm going to depend on your answer to decide if I want to loan you money.
Yes.
I mean, I love it that in the financial world we laugh about it. In the healthcare world, that's the norm. And interoperability, where do we not have this interoperability? It's only two places, healthcare and
Healthcare.
education.
Yes.
If you move your kids from one place to another, you're taking a printed copy with you. Here's how little Johnny did in in 3rd grade in St. Louis.
Another kind of moving thing is we're getting more records and information available. It also means that there's also the opportunity for people to hack into that information, right? Can you play the role, what's the role security plays with electronic health records and just the stewardship of protecting the data, and what your thoughts are as it relates to securing patient records with electronic health record technology?
So we take that that's a very serious challenge. With the stuff that we use, with the product that Brian's using, we've gone through 5 different security audits to make sure we're as solid as we possibly can be. We're wireless. We're a mobile device that gets carried to houses, that may be left in a car, that might get broken into in a shopping center, that could be lost, could be stolen, it could disappear at the airport. We have to be certain, we have to be as certain as we possibly can be that the data is secure and safe. Now, the only way to be 100% secure is to put it behind a brick wall and don't give anybody access.
Right.
You put it in safe, weld the safe shut, you're okay. We have to give this guy, we have to give the healthcare professionals, we have to both protect the data and give the data to the appropriate people. So we go through a lot of security audits. I think we still have to, what my team has done primarily is we borrow. We look at, well, what did the financial world do? How did they solve this problem? What are the kinds of techniques that they use? And we're not looking for healthcare examples, we're looking for industry examples of how do other people do this.
Best know methods, best
Yes,
practices.
from any industry, and then let's apply them in healthcare.
Great.
It's not that we're that smart, it's that other people who are smart have already solved a lot of those problems, and we're trying to apply them here.
Excellent.
And for doctors, I mean, we rely on Stanley and the teams at various EHRs for that kind of keeping patients' protected information safe. For us, the main thing is communication among doctors. There's not a gold standard for that. That's why doctors still, and there is a big benefit to actually speaking with another physician about a patient. You know, handoffs are really important, which we do by, verbal communication. It's just better. So phone conversations are still very common, but there is a role for secure messaging with patients, and that's something that I would love to see. No one has kind of grabbed hold of that yet.
Right.
There's a bunch of players trying, but it again becomes one little community. If I wanted to just talk to the ER, or that would be the best example of a prior cardiologist in St. Louis. Well, I'm just going to have to call his office. Oh, it's 1 o'clock. Oh, the office is on lunch break. It's not necessarily time-sensitive information.
Right.
An email would be great, a secure email, any secure communication. That's something has always been a dream of mine, is that I could securely communicate with any doctor anywhere.
Excellent. Well, gentlemen, it's been a great discussion, and we'll look forward to talking with you guys in the future on electronic health records.
Thank you.
Thanks very much.